Hi guys, my name's Crystal Bay, also known as Crystal Phoenix, and today we are going to talk about the effects of long-term trauma on the body and how it affects us medically. And I am very proud to present Dr. William John Monsour, MD, President of Wellness Addiction Recovery Services in Greensburg, Pennsylvania. It's a full service outpatient treatment center for all forms of substance abuse. The website listed for anybody that would like to know more. Welcome, Dr. William. I would just like you to introduce yourself real quick, and then we'll get into getting down to business.
Crystal, thank you. I look at this as quite a privilege to be able to share some knowledge with your listeners and add to the fine work that you're doing in trying to help guide folks through a very difficult issue that is a lifelong battle for most, and maybe give some hope to folks struggling with the after effects or the ongoing effects from current or past abuse, especially emotional abuse, which really is probably the worst of all the abuses because of the myriad of effects that it has. And so it's a real pleasure to be here. I appreciate you asking me to do this.
Of course, I'm going to ask. Your family, number one, and I trust you. I trust you to be honest. And coming from the medical field, I've seen some of the work that you do. Sandy has told me a lot about it. I want to have your opinions on this because, as somebody that I trust who is in the medical field, my listeners will know that what you're saying is true and actually take it into account. Having the personal connection between us is actually going to help my readers see that hope and everything because they know that you're not just going to bullshit your way through it. They think a lot of doctors do.
The type of medicine that I practice now, which is exclusively addiction, deals with the behavioral and mental health issues that contribute to addiction. In the center, the Wellness Addiction Recovery Services Center, which is WARS, we call it WARS, it's our acronym, WARS, that's website's warsnow.com. But what we do in that center stems from really three core principles, which is love, empathy, and compassion, but not sympathy. And the reason I say that is sympathy implies that there is a condition that can't be changed and that is of no direct fault or result of circumstances, either personal or from environmental, that have made a situation that is not fixable and that's irreversible. And compassion, empathy, and love, though, really garners the cultural values that build a great support structure. And so with the center, what we do, on staff, I have certified and licensed counselors. These are master's degree people who are licensed by the state of Pennsylvania. And what we do is everything from trauma counseling and to all of the other counseling that goes along with the behavioral health issues that surround addiction. When you asked me to come in and do a seminar or a podcast on the effects of emotional abuse in childhood and their short and long-term effects moving into adulthood, it fits right in with what I do every day and what my center is geared to assist people in helping them to find a recovery from substance abuse. And recovery is a very complicated issue for the physicians and the providers because there's no one answer to any one person. Each person has an individual formula that you have
Absolutely.
to find, and you have to work with these folks,
Yeah.
and you have to work hard with these people to do the inventory that you need to do and to allow them to learn how to do self-inventory so that they can manage to find that formula along with your guidance and support. We create a support structure around people that are struggling with addiction. And so a vast majority is dual diagnosis treatment, meaning that we're treating the depression, the anxiety, the PTSD, complex PTSD from the shame and guilt of emotional abuse in childhood, as well as the neglect and the physical and sexual abuse as well, to try to find that formula that is individualized to everybody that is searching for recovery. And so I think that I have a pretty good handle on the issues that you want to talk about. I'm ready to give it my best shot.
And I appreciate that, especially as somebody who has been diagnosed with complex PTSD. You've known me since I was 13 years old. You know, that's a very fitting diagnosis for me.
There are 17 symptoms of complex PTSD.
Yep.
Okay. To sum most of them up, really, this is the type of PTSD that has a more immediate physical response and a lasting lifetime battle than
Yes.
just a PTSD from, say, a traumatic event.
Yes.
Because this is a very long process of
Mhm.
continued abuse that causes a lot of physical changes and a lot of emotional changes moving into adulthood. Flashbacks, memory lapses, distorted sense of self, inability to control your emotions, hyperarousal,
Yep.
unexplained upset stomach and GI upset, and irritable bowel syndrome, and sleep disturbances.
Just to
It
name a few.
challenges every one of your interpersonal relationships as you move forward. These are very common issues in substance abuse.
Yes, they are. As somebody who went through the battle and won the battle with substance abuse and everything, I can completely relate, and I love the work that you do.
Thank you.
Let's get into the nitty gritty. So, can you explain how emotional abuse can impact the person's overall mental and physical health? Because I do agree, emotional abuse is the worst form of abuse there is because those scars are deep and everlasting, truly.
And quite often the emotional abuse from childhood is an escalatory abuse. In other words, it escalates into a type of abuse that can end up in physical abuse and battering. So the scars are very deep, and typically emotional abuse not only just has the short-term effects, but long-term effects as well. It affects both your physical and your mental health with feelings of confusion, anxiety, shame, guilt, frequent crying, over compliance, being a people pleaser. When I see a patient and I'm talking to a patient and they seem to have some of the traits that I look for from past emotional abuse, it actually triggers some questions that I can get into with them. But minimizing toxic moments, finding excuses to please other people, getting angry or frustrated very easily, often feeling really defensive, tending to view oneself negatively, low self-esteem. All of these are key elements to where you need to really drill down to find out with questions that are directed towards the emotional abuse from childhood or even suppressed feelings of previous trauma from abusive relationships. And these are things that you look at as red flags to try to help someone to understand themselves enough where they can do a personal inventory of how they got to where they are right now, and then what they need to do in order to build trust in us as their counseling services, but also in themselves so that they can, feel strong enough to even attempt a recovery. But the physical effects are also there. Long-term effects, high blood pressure, weakened immune system, gastroesophageal reflux disease, ulcers, irritable bowel, increased illnesses, just common colds because of the suppression of the T cell immunity that happens against viruses that we know stress can cause. And then, of course, PTSD, which would be if you're looking at a patient, you're trying to figure out exactly what questions you need to ask about their past that has allowed them to have these complications, these long-term complications that might lead to their addiction, trouble sleeping, flashbacks, nightmares, emotional distress. All of those things are the impacts of persons who have experienced mental and physical complications of emotional abuse as a child.
Wow. A lot of the mental effects I knew
Mhm.
from my own personal relationships and also with my work with survivors of domestic abuse, helping them to do exactly what you said, learning to trust themselves, rebuilding themselves. Because what I like to call myself is I am a personality recovery specialist.
That's
So,
terrific.
and it is, a lot of it is, but the physical aspects, it were a lot of the things that you listed, I'm thinking I'm going doing my own body check and I'm like, check, check, wow. And I'm learning a
Mhm.
lot. So I'm so glad that I asked you to do this. But then again, I knew I would. So now to the next question, can emotional abuse lead to long-term changes in brain function or
Mm.
structure? From my EMDR therapy and everything, I tend to believe yes, and a lot of the research that I saw says yes, but I'd like to know your viewpoint and opinion on that one.
The long-term effects on brain function are well studied, but it's a difficult study to do, only because you're dealing with causal effect and causality that is so far removed from each other. It may take 20 years for epigenetic changes to happen in a brain, where now you're seeing the effects of what happened 20 years previously. That was an ongoing and long-term kind of emotional abusive relationship, whether it was parenting or whether it was a relationship in your adult life, like a early adult, young adulthood that lasted through your 30s, 40s, 50s, and so forth. As far as what has been found so far in studies, the brain structure changes really are caused by a couple of different things, and stress is among the largest influencers on what happens to the brain because stress causes release of large amounts of cortisol, your stress hormone. And when you get stressed and you start making large amounts of cortisol, well, over time, in prolonged emotional abuse, that hormone production can damage and reduce the function of an area in your brain called the hippocampus. This is the area of the brain that is associated with learning and memory. And emotional abuse is linked to thinning of certain areas of the brain that help you manage emotions and be self aware. So, in addition to having cognitive deficit that happens over years of high anxiety, cortisol released hormone damage to the hippocampus, you also have this thinning of these areas, especially in the prefrontal cortex and temporal lobes. And research has shown that childhood abuse is connected to epigenetic, meaning, and I'll get into what epigenetic is, but epigenetic brain changes that may cause depression. Okay. So we know that epigenetic changes can cause cancer as well. And so we know that there's a causal relationship between stress, and depression, stress, and cancer, stress, and several other diseases that are thought to be from epigenetic changes. And epigenetic changes affect gene expression. So they turn genes on and off. And you have these repair mechanisms in your genes, okay? And that will take an aberrant sequence, say, on your DNA and cleave it off and make sure that it's repaired. And these happen more easily in a younger age than they do in an older age. But with prolonged stress induced from emotional abuse and this cortisol damage that happens in the hippocampus as well as in the prefrontal cortex and temporal lobes, the epigenetic changes will affect the gene expression without changing the DNA sequence. And that leads to modifications that can be transmitted to daughter cells. And then those epigenetic changes can influence the growth of neurons in the developing brain, as well as modify the activity of neurons in the adult brain. And together, these changes in neuron structure and function can have marked influences on a person's behavior. You're looking at permanent changes in brain structure that now in adult life cause a myriad of challenges for the patient in their ability to control their emotions, their ability to have recall and good cognitive function, and so forth. Emotional control obviously has a lot of quality or effects that stem from that in behavior. Having emotional liability or lability can cause perpetuation of anxiety and panic attacks, which leads to depression, suicidal ideation, addiction, coping mechanisms that start to come from coping avoidance as opposed to active coping mechanisms that can be developed at an early age if you're not undergoing the kind of stress that emotional abuse constantly has and growing up through that as your childhood. There is a definite change in brain structure, and there are definitely verifiable epigenetic changes that help to perpetuate an inability to find good coping mechanisms as you grow older for things that basically all life experiences give you, which is things that can cause you anxiety, things that can cause you grief and loss, things that make you feel ashamed, things that you have to deal with that have you coping with feeling guilt, those kind of things. So there are definite brain changes, and those are the ones that are probably among the most prominent. There are probably a lot more that we don't know about. But cortisol is really the genesis of a lot of those brain changes over time that occur. That might take 15 or 20 years.
That makes a lot of sense. So let's get a little bit into the physical health impacts. You had mentioned like IBS syndrome and different dietary effects and cancer and stuff. So how does chronic stress from emotional abuse affect the body, particularly the cardiovascular and the immune systems?
I could tell you short term, panic. A lot of your listeners are going to understand panic because everybody experiences anxiety. And in anxious states, it causes rapid heart rate, constriction of blood vessels, higher cerebral perfusion, higher blood pressures, cerebral blood pressures. It causes perspiration. There's just an entire flight of responses that happen in that anxious state. Now, over time, those are all stress-related incidents to the development of heart disease. So we know that because of the short-term effects, a rapid heart rate and other things like headaches, nausea, and then the gut problems, the gastroesophageal problems, peptic ulcers, gastric ulcers, the release of huge amounts of acid in your stomach, the histamine response and adrenaline responses, all of those have an impact on your cardiovascular system. As far as the immune system suppression, we think it's probably related once again to cortisol. But I'm not sure that anybody's really identified a link. But we know that there's suppression of T cell immunity. T cell immunity is the immunity that humans have that is, your effective response to viruses. Okay. People under a lot of stress have more common colds, they get influenza, they're just more prone to illness that is typically caused by viral disease. But there is also some evidence that bacterial illnesses are also increased, and that's probably because they're secondary responses to viral illnesses. So viral illnesses knock down your primary response and your protection, and then secondarily you get a bacterial infection. As far as when you look at the long-term effects of prolonged emotional abuse, eating disorders and the mental sides and the sequelae of depression, anxiety, and like eating disorders, they're contributors to diabetes and to stroke. Obviously, eating disorders where you're not talking about bulimia, you're talking about overeating. And a lot of sexual abuse patients end up obese and really overeat. Then you're looking at all the obesity-related illnesses, which is also heart disease and stroke and hypertension and hypercholesterolemia and diabetes. Now you just bring in with those big major medical problems that are chronic problems, you bring in all of the side effects of those diseases. And so you can see that as a nidus for developing adult illnesses in a long-term effect, physical effects, medical effects. They can't be separated from the emotional effects, but also they are self-perpetuating because of all of the things that are related to the side effects of those big diseases. If you really go back to patients who have suffered emotional abuse as children, these large illnesses, these big medical problems can be related to the whole ecosystem of how that individual and what that individual's had to deal with. I don't see a lot of separation between any of these large, heavy medical illnesses and diagnoses. I don't see a lot of separation from that and emotional abuse once I drill down and find out that it actually happened. And then going to therapy and referral to specialists that can provide cognitive behavioral therapy and in-depth therapy like trauma therapy with patients that have experienced this significant trauma can actually help you as a internist or a regular family doctor be more effective in your treatment of these folks. The approach to a patient, it has to be a 360-degree approach. And if you do have that, and you've drilled down and you understand that there was an emotional abuse history, having therapy for that emotional abuse, which can make a huge difference, can also make a difference in the way that you treat all these other illnesses like diabetes, heart disease, hypertension, high blood pressure, high cholesterol, and the like. But there is definitely a link, and those are the long-term effects that are all increased in patients that have the emotional abuse as a child.
That makes a lot of sense. And looking back at my own medical history, because one of the things with my panic attacks is shortness of breath is a big thing when I start to have a panic attack or things like that.
Mm.
And I've noticed now as an adult, looking back, I remember having pneumonia and bronchitis a lot as a kid and even as an adult. And you knew me, I was an athlete as a kid. I played softball, I did all the sports. So the fact that I get winded just walking around the farm at times, it confused me, except for the fact that I am a smoker, but it shouldn't be that bad because I still kept up with the walking. And after everything that you just explained, I'm getting a lot of clarity, even though within my own medical history. I really do appreciate all the research and your work and everything because it's giving even just me personally a lot of clarity into my own recovery and treatment and how I need to shift certain things and work on certain things to be able to get my body back in balance and everything.
Mhm.
Um, we'll move on to the next question. The connection between emotional abuse and the development of chronic pain or psychosomatic symptoms. What do you think the connection with that is?
There's some pretty obvious physical ones. People affected by previous injury and emotional trauma, injury being one form of trauma that can cause, obviously, chronic pain. Chronic pain is a centralized pain. It's not the peripheral type or somatic type pain that you get if you burn yourself on the stove or you step on a nail or whatever. Chronic pain is a different type of pain. It's a centralized pain, and that becomes almost like a brain stem pain. You can't get rid of that pain, and it's very difficult to treat. A lot of times, because it's related to previous injury, when you add emotional trauma from emotional abuse to it, then there may be anxiety issues that have what we call the hyperarousal symptoms. And those cause muscle tension, leads to muscle spasm. And then you get in a spasm, tension, pain cycle where you're adding acute pain onto chronic pain. So it definitely has an effect and a contribution to chronic pain suffering. So if you're carrying that hyperarousal where you have panic or anxiety disorder and depression as well, all of those emotional effects of that prolonged emotional abuse you had as a child are going to play into making your chronic pain harder to treat and much more difficult for you to cope with because of the mental side of it. Now, psychosomatic symptoms is a bit of a different animal because some people have chronic pain that's not tied to an injury or a physical illness at all. And we call this response psychogenic pain, or some people say psychosomatic pain. But it's caused by psychological factors such as stress, anxiety, and depression. And so it is indistinguishable to the patient. It feels exactly like your spine has a herniated disc, or that you have a really bad issue with your spine and your neck or your thoracic spine, or that your knees are in need of surgery, or you have to go get them analyzed because you think that there must be bone on bone and these arthritic changes must be massive. And the fact is, when you do get the MRIs, the CTs, the X-rays, and everything else, you don't see the injury. You don't see the causation of the type of pain that they're exhibiting. And so that's when we start to say this could be psychogenic pain. And psychogenic pain is very common with folks that are suffering from the side effects and the long-term effects of emotional abuse as kids. And very many of them will seek out one doctor after the next doctor, chasing down a diagnosis that doesn't exist in reality by physical standards, but does exist by their emotional standards in the way that mentally they're enduring this pain every day. Those are very difficult patients to treat. And if you can find the connection to previous emotional abuse that's now causing them to have a complex PTSD, and they can find some outlet and treatment that helps them start to not only inventory themselves, realize that this is a big contributing factor, but start to feel like they can actually gain control, or at least some control over how to cope with it, as opposed to not knowing that it even exists, then you can start to affect that chronic pain that they're experiencing, and it starts to diminish and maybe even can be eliminated altogether. And many times that's also complicated by their lack of desire to want to go out and get in an aggressive program where they're stretching and working out and finding meditation and pursuing that coping mechanism that isn't basically just mental relief or release by escape, but also a release physically by physical fitness. And so they become very difficult to treat. But there is a major difference between the added effects of emotional abuse and what that causes in emotional strife that contributes to chronic pain, as opposed to the psychogenic pain, which is pain that's not associated with physical injury and no real physical proof of why that or where that pain is coming from, and yet is still there. So it's a hard diagnosis to get to, but it's even harder to treat when you do find psychosomatic pain, because it's an emotional and psychological issue that is the driving force of it. I hope that explains it.
Honestly, the whole entire time I was listening to you talk right there, all I could think of was, wow, I wish we'd had this conversation 3 years ago. You have enlightened me in so many ways. And we're only halfway through the questions even. I'm so grateful for this. I can give an actual example of the whole psychosomatic. When I start to feel anxious, I get a pain and just straight through the center of my back. And once I start to calm down, the pain goes away. There's no physical injury. There never has been to that area of my back or anything, but I get that chronic, just aching pain.
Mhm.
And what you were just talking about just explained it all.
Remember, that may not be psychosomatic. It might not be a psychogenic pain. You might have real muscle spasm, and because of muscle tension. When you get tense, you send adrenaline through your body, and that causes all of your muscles to tense up. Now, if you have an area that, and we all do, nobody escapes getting some arthritis and having issues with their back or their long muscles, their quads, their biceps, their hamstrings, all of the big muscles in the body, and the insertion sites and the joints and everything. Everybody ends up with some form of muscle ache, weak parts in their spine, degenerative joint disease. We all get it. Okay. But if you have stress, that stress causes the anxiety that stimulates the response where you have an adrenaline release, you have tight muscles and tension in your muscles. At those areas and those points in your body that are more easily affected by muscle tension, you can have spasm, and that spasm causes real pain. That pain is because of a real physical issue that is stimulated by an emotional issue, but then becomes a physical ailment. It's not necessarily true that you're just experiencing a psychogenic or a psychosomatic symptom when you're feeling that achiness in your back, or you just feel tight that day, or when you stretch, you just can't stretch as good to one side or whatever. all of that still may be emotionally charged, and it may have begun by an emotional response that might be a response to an emotion that you experienced that now has contributed to muscle tension that is now focused in on, say, portions of your body that are more prone to muscle spasm. So I don't, when you say psychosomatic, it's be careful because really it's a separate, it's a very distinct and separate thing. When you're experiencing pain that has no physical attachment, okay, or no provable physical attachment, because stiff muscles, or you just feel stiff, or you're having an anxious day and you have a little depression, you can't really stop your thoughts, you got flights of ideas, you're getting a little bit confused, now your heart rate's up, you're starting to perspire, you're starting to feel like, oh God, I might have a panic attack. The anxiety is starting to build upon itself. You may even try in the middle of an anxiety attack to say, why would I be anxious? The sun's out, I don't have anything to do, I have the whole day to be me, I have me time. Why would I be feeling anxious? So that all just adds right to your anxiety and panic. It accelerates everything. Pretty soon now you're sending adrenaline into your muscles, you're tightening up your muscles, are getting more and more tense, and they're putting more and more pressure on joints that may have a little bit of arthritis. And you can see where I'm going with this. So you
Absolutely.
just got this snowball rolling down the hill, and before you know it, it's a boulder. And then you're stuck in it, and it becomes this cyclonic effect where you can't get out of the whirlpool. And it really can spiral completely out of control into a full-blown panic attack where you're having chest pain, your coronary arteries are constricting around maybe previous plaques that weren't considered pathological, and you can have a heart attack. And you can definitely have a heart attack. We call that, some people call it Prinzmetal's angina. An anxiety attack can definitely precipitate a heart attack by the same mechanism I'm talking about. And you don't have to have a big blockage in your coronary artery to have a heart attack if you're having a lot of spasm that's due to an anxiety attack that's increased your heart rate, increased your blood pressure, and all the other effects of that histamine response and the adrenaline response to that. You have to
Yeah.
make sure is really distinctly separate from a psychogenic or a psychosomatic illness.
Thank you. So now let's go into what your area of expertise now. How does emotional abuse increase the risk of substance abuse and addiction? I know how it did within me. I wanted to be numb. I didn't want to
Mm-hmm.
feel the depression, the anger, the pain, the feelings of not being worthy. Insert here when it came to it. I just wanted to be numb. I wanted to feel either nothing or I wanted to feel good. And that's why I turned to substance abuse at
Mm-hmm.
the time.
It's a very
So,
complicated question, Crystal. It's a great question. And doing this every day, I've learned quite a bit from a practical sense of how to treat these patients. But when you really dig into the science, emotional abuse can lead to trauma, physical trauma, but destructive tendencies that go along with physical trauma that can increase the risk of substance abuse and addiction. So, emotional abuse in and of itself leads to poor coping mechanisms. There's an old model that really is the stress and coping model of addiction. And what the stress and coping model of addiction states is that it views substance use and possibly other problem behaviors as deriving from a high level of life stress combined with a low level of active coping skills and a high level of avoidant coping. Now, avoidant coping is getting numb, escape. People might use substances to numb the pain, deal with PTSD, or escape from depression and anxiety. These people may not seek therapy, and instead they self medicate by experimenting with drugs and alcohol to cope with their stress, or even smoking, or other forms of addiction like gambling or sex addiction. These are all forms of escape. They're all forms of self medication, whether they involve a substance like a medicine or not. One study found children that have experienced emotional trauma from abuse have a 4.3-fold higher likelihood of developing a substance use disorder in their early adult years and throughout the rest of their lifetime. That's 4.3 times the normal rate. And that's just in one study. I personally, because I treat addiction and I have so for more than 2 decades. This, I think it's higher than that, but it is there, and it is a significant increase in substance use disorder. The problems are really basic to coping mechanisms. The issues are deeply entrenched in the way that through adolescence, the developing brain is affected by emotional abuse, but also once they start using drugs, then that compounds the changes in the brain that actually prevent you from finding a way to cope with life stress with active coping skills, and pushes you more and more to avoidant coping skills, which is basically you're coping by avoidance of the issues that you need to be looking at and that you don't know how to cope with, that may be the ones causing or triggering your anxiety and your depression and your suicidal thoughts and your shame and your guilt and all the other issues. There is an overwhelming abundance of evidence that all of these types of emotional traumas lead to drug abuse and substance abuse and addiction. We deal with that every day, and there's a lot of PTSD that comes in. Our dual diagnosis treatment, usually I can say probably with relative certainty that 60% of our patients are on medications for depression and non-narcotic medications for anxiety. But that's a whole nother issue to talk about, the avoidance of benzodiazepines.
Yeah,
The thing about
that's
treating these kind of problems in people that have addiction is you have to find other ways rather than the narcotic approach, which is the push button approach of most psychiatrists, that they just knee jerk reflex into benzodiazepines and antipsychotics. And you really have to be careful when you're dealing with addiction. But the increased risk of substance abuse and addiction in these folks is well documented.
You did talk about some of the unhealthy coping mechanisms for victims of emotional abuse, whether it's childhood or domestic. What are the consequences of those behaviors a lot of times? Besides the fact that you don't fix things
They
by
interfere with
being
relationships. I can tell you one thing. As you're growing older, your relationships, your love interests, the human need for intimacy, all of it becomes more and more important as you age. And these are big challenges for creating healthy relationships. And outside of what substance abuse does and how that has the legal ramifications, the physical ramifications, all of the disasters that are well known with drug addiction, the ones that really go unsung a lot of times is the problems that it creates with you developing interpersonal relationships with people and even with family. A lot of times it can lead to isolation and feelings of hopelessness. It can foster a stronger belief system that you're not worthy or that you're worthless or that life is hopeless. These all kind of feed back into your depression and anxiety and issues that then tend to become like a revolving door in a downtown office building at 4 o'clock in the afternoon. You can't get the hell out of it because everybody's trying to leave the building and you get trapped in it. And that can cycle and really spiral out of control in a lot of different ways. You have emotional instability. That doesn't work well with relationships. You have the inability to communicate because you really didn't learn how to develop those communication skills under the stress and stressors that you've had to deal with all your life. There are a lot of things that can go into, other than the problems that addiction creates, in life. Oh my God, it concludes everything. It'll go into your relationships at workplace, how well you can stay in teamwork and within a team structure, how you communicate with people in a social manner. All of those things are affected. So I don't know if we don't have enough time. Let me just put it to you that way, to look at every single effect of this spider web because it's gigantic. And what we try to do is we try to simplify the problem to the core issues that allow you to get a hold of those first and then let the answers and the big questions come to you. So you get into working through a process that allows you to separate from focus on all the big issues and all the big complications and are simplifying it down to a couple of core things that you need to focus on in order to get yourself in a condition where it's easier for you to cope as you move forward with the things that typically would send you off to trying to find escape or numb yourself down. I think
That getting to the core of the problem, the roots of it, does
Mhm.
help to alleviate the rest of it, because once you can help fix what the core problem is, a lot of that spider web will evaporate on its own because
I think you're right.
you've remedied what the root problem was.
Mhm.
No, I agree completely. What do you think the role of medical intervention in addressing the physical health issues resulting from emotional abuse?
It's a never-ending problem that I hope that someday we can actually
Especially with HIPAA
have
and
a better
everything.
and more concerted effort to change, because really a comprehensive history and physical exam should include the questions regarding previous and ongoing emotional abuse, as well as all forms of abuse, physical and sexual. And a lot of doctors, a lot of providers, they shy away from this, whether it's uncomfortable for them because they themselves have gone through it, or whether it's just an uncomfortable subject to them because they don't realize the scope of how widely spread it is. And they'd rather not just touch on it and assume that it's not going on with the patient in front of them, when in fact it may be and probably is. And the patient in front of them may be really well adapted at hiding it. So I think that the role of medical intervention in addressing the physical and mental health issues related to emotional abuse should really come down to a comprehensive history and physical exam that includes questions regarding previous and ongoing forms of abuse. If there are concomitant physical manifestations of abuse and you can see them and document them, then you're obligated to refer to a higher level of therapy, or a therapy that involves expertise that you don't possess, so that you could augment the effectiveness of your treatment plan for the physical illnesses that you do have the experience to treat. So if I'm looking at someone who comes into my office and they have previously undiagnosed diabetes, they're obese, they have previously undiagnosed high blood pressure, they have chronic pain, this one of the things that I'm looking for and drilling down on in an unassuming manner, in tones that are non-judgmental, with calm and direct language that doesn't put people on the defensive. I'm looking for the emotional abuses that happened in childhood that may be contributing to these diseases that are now being diagnosed for the first time in an adult, because I know that they're going to help me, if they exist, once I find effective treatment for them, to treat all these other illnesses, right? So it's all about the comprehensive exam. And that's where the intervention from medical providers needs to improve quite a bit, in my opinion, because those concomitant physical manifestations, they're there. And if they're stemming from emotional abuse or childhood sexual abuse, and they're part of PTSD or a complex PTSD syndrome, you're never going to be as effective at treating their diabetes, their heart disease, their hypercholesterolemia, their obesity, their smoking related problems, without being effective by making an effort at getting to the mental side of what can be also the part of the driving force of these diseases getting worse. That's what I think the intervention of the medical community needs to improve. It's got to become normalized.
Absolutely. And honestly, you, with that statement that you were just making, covered actually the rest of my questions for you. I completely agree.
There's an acronym, Crystal, that I think, like, gosh, I want to say this was, I'm not sure. I don't want to say the study. This was done by a major Ivy League
Mhm.
study group. And they came up with an acronym, and the acronym is AVDR. And this is how, within a physical exam and a comprehensive history, that providers can make a real big impact, I think, on the intervention and diagnosis, at least the diagnosis and identification of people that are suffering from the complications of emotional abuses and other type forms of abuse as children, So ABDR, the acronym stands for asking is A, and you're asking patients about abuse. So you're adding that into the comprehensive history and the physical exam. The V stands for validating. You're validating the message that all forms of abuse are wrong, and you're confirming the patient's worth while you do it. Okay. So that's the A and the V of AVDR. The D is documenting the presenting signs, the symptoms, their disclosures. You're documenting all of it. And lastly, and certainly not least, referring these victims to domestic service specialists, counselors. Psychological counseling is extremely important. Getting into cognitive behavioral therapy, finding support for recovery in addiction services, treating their depression, their anxiety, with complicating anything with heavy narcotics or benzodiazepines and opiates, and for chronic pain, finding ways that can help folks find a higher level of care for something that you may not possess the expertise is going to help you in the long run treat the total patient, help identify, but also then become more effective at your treatment plan. And so ABDR is a really good acronym. And obviously, physicians have to use non-judgmental tones and language while they add it into their comprehensive history. Adding one question about domestic abuse to the routine health assessment is an important first step in improving healthcare for all victims. But really, to summarize what ABDR, that approach is, and how it could be integrated into the intervention process, it could be integrated into managed care systems. It could be part of universal screening that could help save victims from further abuse and help prevent and treat the complications of abuse and prevent future abuses from happening. That acronym is a great way to actually encapsulate what they need to do when they're doing histories and physicals.
And not just physicians, but myself as a coach, all providers.
Asking. It starts with
absolutely.
asking. If you remember to do it, you ask, you do it in a non-judgmental way. It's a matter-of-fact question because it has real relativity to what you're doing.
Yeah.
You're a caring physician. You want to know the mental as well as the physical aspects of what a patient's life is, right?
Yeah.
So it's not so damn difficult to put it in and to do it in a way that seems comfortable and normal to talk about because of how widespread abuse is. It should be delivered with your screening programs. And then, of course, you're validating the patient. You're validating the message that forms of abuse are wrong. Heck, a lot of times the abuser, they've become so conditioned to their abuse that they blame themselves for being abused. They've lost so much self-esteem that they feel like it's their fault. And just having a validation that it is wrong and that you're not a participant in this as a guilty party, you're not a reason for why this is happening. Over time, it may not work in the first session, but over time, if you go back to it, you revisit it, you add it into future visits, you'd be amazed at how somebody finally feels comfortable enough to say, you know what, doctor, this is what happened to me when I was a kid. And I had this going on from the time I was in second grade all the way through. And now all of a sudden, now you've got a link that'll help you become more effective at treating every single thing on their diagnosis list. You're going to be more effective at everything you do now. And so if a physician just takes the time to even add one question or two questions, and then has the foresight to come back to it with future visits, and until that patient feels comfortable enough to open up, well, what a jump forward in your ability to be effective as a physician by treating the whole patient you will become. And what that ends up doing is it gives you a lifelong connection with that person where you're making a difference every time you see them. And every time they see you, they walk out of your office confident that they're gaining a control and a coping mechanism they never had before. They feel that, and that starts to build their self-esteem. That's all part of creating the structure around someone so that when they walk out of our office and they've talked to every provider in that building, and all of us give a damn, and we care enough to dive in, take the deep dive, and work these things out while we validate you and while we support you, that works. And it helps people to find avenues that are individual to each patient of how they can manage themselves on their path in their life with all the stressors they have to deal with, and find new coping mechanisms that don't involve drugs and alcohol and cigarettes and gambling and whatever.
Absolutely. I, as you're saying that, all I can think is putting out the challenge of what if we get it implemented in just our everyday life? What if everybody decided to implement that acronym into their everyday? Could you imagine how much better the world actually would be if we could all lead that way? And
Would be a much
Mhm,
better place. And there's not a single human on earth that doesn't suffer from psychological
mhm.
factors. But,
Exactly. And it's
you
just,
know,
I love that. I'm going to implement it in more than just my coaching, but I try to lead my life with kindness and respect anyway.
absolutely.
So I love that. And honestly, I can see why my sister is, even now, she still has so much love, respect, and admiration for what you do and everything. He's brilliant and was so excited when she found out that we were going to be working on this project together. So thank you so much.
It's been my pleasure. I hope it
Mine
helps,
too. I'm
your
Yeah.
listeners,
Mhm.
yourself. Honestly, I can tell you that from diving,
Yeah,
treating these illnesses, being a doctor, it's helped me. Knowledge is king. And sometimes just imparting knowledge has a profound effect, much more profound than you would ever think that it has when you share your education with other people. But you're, in a way, while I'm practicing this kind of medicine, it's reaffirming and also establishing a learning curve for me as well. So, all great teachers are great students, and all great students are great teachers. That's that simple. And so,
absolutely.
when you really go into learning, and you start to see and cause and effect, and you start to read the studies and all of the fine work that's come before you, you can't help but benefit from it, and it helps you grow. And believe me, just from being a physician who's looked at by his patients as the leader of their treatment team and a trusted and respected structure guide for them, I can tell you that I'm learning every single day from every single patient, because every single one of them is different. And so the approach is a grandiose massage. You're as absorptive as you are applying your skills as trying to find treatment. And that's the approach that keeps you ever learning, evolving. Sharing knowledge is really important. That's why this podcast is so important.
Absolutely. Sharing knowledge, like you said, knowledge is king. I don't like to
Mhm.
use the word knowledge is power because I don't want to feel like I have power over anybody. I want the world to treat each other with kindness and respect. But yes, we're always learning.
Well, I say king because
Mhm.
we're all subjects to the king,
Exactly.
you
But
know?
I have this thing that I always joke with my friends when we're collaborating, that each of us brings together a piece of the puzzle. We all learn from each other. We each have our own special touches and brands and everything else. And when we all work together cohesively, we're going to make this kick-ass 3D model of the Harry Potter Hogwarts castle. Because, well,
I love it.
I'm a Harry Potter nerd, everybody knows that. And it's true though, and everything that you're saying with the way that you work with your team and your patients, like I'm envisioning these really amazing puzzles coming together by the time your patients and your clients have graduated the program. Their puzzle is no longer misshapen, but it's built into something beautiful, and they can go out and help others in some way. And
That it is the goal,
Mhm.
and it works because it follows the rules of 6 degrees of separation. You never know who you are touching by touching one person, and you're touching many more than you think. And that's what we do. I think if you go on the website warsnow.com and you look at the comments for the people, that not a lot of people in addiction want to leave a comment about their treatment, but we have our comments are 5-star related comments, but they are all centered around what their recovery and the assistance by us and the structure we provide, has allowed them to accomplish in their life.
Yep.
And
And
so
that's the
that's given
greatest
them
testimonial you can get.
that's right, because it's given them a solid foundation for the first time. It's allowed them to add coping skills that are active coping skills that they never had before. It's allowed
Exactly.
them to raise families and contribute to society and build careers and work in jobs that pay taxes, that go right back into the socioeconomic status of their communities. They hold their chin high when they walk into the grocery store. They feel confident about their future. They have more self-esteem than they've ever had in their life. It's so unbelievable that what just flowers out and blooms out of
Mm-hmm.
that first taste is all they need to get to. And once they do, oh my goodness, it is the drug for the rest of their life. They start to feed on it, and their
Yep.
inspiration and their of what they're doing only helps them grow in
Yeah,
accomplishments. And it's
absolutely.
amazing, Crystal.
Mm-hmm. It
It's one
is.
of the most
That
gratifying jobs I've ever had because of that.
whenever I see one of my coaching clients have that light bulb expression when I
Mm-hmm.
guide them to the next step of learning to trust themselves, figuring out what they want, just watching them light up as they come
Mm-hmm.
to that realization. Because as a coach and as a therapist, you guide. You're not supposed to give them the answers.
No, no.
You're
Mm-mm.
supposed to help them find it within themselves.
It's
So
about inventory.
yeah,
People
it's
don't know how
so
to do self-inventory.
gratifying.
You got to be the guide.
And every time I help somebody else, it also helps me feel heal my own wounds
Mm-hmm.
because it's amazing. And knowing that I helped them to acknowledge that they weren't at fault. It wasn't their fault. They didn't ask for it. They didn't deserve it. When they
Mm-hmm.
finally come to that realization within themselves, it's so gratifying. And then they want to turn around and help others in that
Mm-hmm.
way, give hope, and are able to go back into the world functioning and be able to have a job without anxiety and all of those things. So I understand completely where you're coming from on that. And I'm so grateful for you giving me this opportunity to talk with you. I've learned, I know my listeners are going to truly appreciate this. So I want to say thank you so much um for joining me today. I'm just in awe of all of the work that you've been doing.
You're welcome, Chris.
And thank you all for listening. And the website will be listed in the description. Please, if you have any questions or want to reach out, you can. Have a wonderful day, guys.